Emergency postcoital contraception. What is it and how does it work? A number of regimens, often referred to as morning after pills, are available for emergency postcoital contraception or EC, which is needed after unprotected voluntary coitus or involuntary situations such as rape. So, this means that emergency contraceptive pills helps a woman avoid pregnancy after she has sex without contraception. Emergency contraceptive pills helps to prevent pregnancy when taken up to 5 days after unprotected sex. So the sooner they are taken, it is much better. It may be important to explain to women postcoital methods such as Plan B, one step, and next choice do not cause abortion. It is said that emergency postcoital contraception do not disrupt an existing pregnancy. It is also safe for all women, even women who cannot use ongoing hormonal contraceptive methods. The pills works by inhibiting ovulation and interfering with fertilization by slowing the transport of sperm.
There are two types of emergency contraception: the emergency contraceptive pill, Levonel or Ella-1, the one that we call morning after pill. The advantage: the sooner you take Plan B, the following unprotected vaginal sex, the more effective it will be in preventing pregnancy. Plan B is approximately 95% effective if taken within 24 hours of unprotected vaginal sex, 85% effective if taken within 25 to 48 hours of unprotected vaginal sex, 58% effective if taken within 49 to 72 hours of unprotected vaginal sex. Plan B is less effective in women weighing between 165 and 176 pounds. Disadvantage: the most common side effect of Plan B is nausea. Although very few women, only 6% who take Plan B will actually vomit. Other possible side effects, which are temporary and usually last only a few days, include mild abdominal pain, fatigue, headache, spotting or bleeding from the vagina. The uterine device or the IUD. A copper IUD is a small device with a fine copper wire wrapped around a plastic frame. It's placed inside the uterus to prevent pregnancy. A fine nylon thread is attached to the IUD. The thread comes out through the cervix into the top end of the vagina. Although an IUD is an effective method of contraception, there are some things to consider before having one fit. Advantage: it protects against pregnancy for 5 or 10 years depending on the type. Once an IUD is fit, it works straight away. Most people with a womb can use it. There are no hormonal side effects such as acne, headaches, or breast tenderness. It does not interrupt sex. It's safe to use an IUD if you're breastfeeding. It's possible to get pregnant as soon as the IUD is removed. It's not affected by other medications. And lastly, there's no evidence that an IUD will affect your weight or increase the risk of cervical cancer, womb cancer, or ovarian cancer. Here are the disadvantages of inserting an IUD. Your periods may become heavier, longer, or more painful, though this may improve after a few months. It does not protect against STIs, so you may need to use condoms as well. If you get an infection when you have an IUD fit, it could lead to a pelvic infection if not treated.
Future trends and contraception. Option in women should include hormone-releasing vaginal rings, a simplified contraceptive implant delivery system, a hormone-releasing IVD, and a monthly pill. The fertility transition in the developing world is not yet complete, and future increases in contraceptive use could well occur at a slower pace than heretofore. However, as population growth continues, the number of women of reproductive age 15 to 49 years is expected to rise in most developing countries. Contraception is also known as birth control, defined as the intentional prevention of conception through the use of various devices, sexual practices, chemicals, drugs, or surgical procedures. Any device or act whose purpose is to prevent a woman from becoming pregnant can be considered as a contraceptive. Birth control has been used since ancient times, but effective and safe method of birth control only become available in the 20th century. Until some method is found that satisfies all the criteria for an ideal contraceptive: complete, safe, no side effect, easily availability, and user acceptability. Elective pregnancy termination. In most cases, the findings in prenatal diagnosis are normal, and parents-to-be are reassured that their baby will be unaffected by the condition in question. Unfortunately, in a small proportion of cases, the fetus is found to have a serious genetic defect because effective prenatal therapy is not available for most disorders. The parents may then choose to terminate the pregnancy. Few issues today are hotly debated as elective abortion.
The birth control pill is safe and super simple. You swallow one tiny pill every day, and that's it. You're protected from pregnancy. But you have to take it every day, so use an alarm or app to help you remember. And the pill doesn't prevent the spread of STDs, so use condoms along with the pill to protect yourself from both pregnancy and STDs. Like other medications, the pill has possible side effects, but they usually go away in the first few months. It has lots of benefits too. The pill can clear up acne, ease cramps, and make your periods lighter and more regular. Want to get on the pill? Your nearest Planned Parenthood Health Center can hook you up.
Medically induced termination. Medical abortion can be done using these medicines. First medicine is the mifepristone. Mifepristone is a progesterone antagonist that blocks the effect of progesterone, preventing implantation of the fertilized ovum and therefore causing the pregnancy to be lost. According to Godfrey Bordeloi-Moorhead et al., 2012, it should be taken before 63 days of gestational age with single oral dose, followed by buccal or vaginal misoprostol, a prostaglandin which causes uterine contraction. Antibiotic prophylactic may also be prescribed for protection against infection. Mifepristone also used for regression of uterine yomayomas or detoxification in cocaine overdose. Yomayomas is a benign, smooth muscle tumor that is usually present in the uterus. It is also called fibroid. Mifepristone drug dosage is 200 mg orally. It followed by misoprostol up to 7 weeks of pregnancy with a drug dosage of 400 micrograms. How mifepristone and misoprostol work. Here are the 5 steps that showed how mifepristone and misoprostol work. The first step, the RU486 molecule mifepristone binds to the progesterone receptors in the cells of the uterus, blocking the action of the hormone. Second, in the absence of progesterone, the following changes occur: embryo detaches, endometrium breaks down, uterine muscles soften to contract, cervix softens, allowing it to open. Third, a synthetic form of the hormone prostaglandin, misoprostol, acts on the uterus in the same way as its naturally occurring counterpart. Fourth, after RU486 has taken effect, misoprostol causes the following changes: uterus contracts, cervix softens further, The last steps, the endometrium and embryo are expelled from the uterus, resulting in what the pregnant person experiences as a heavy menstrual period. Mifepristone blocks the effectiveness of progesterone, a hormone key to maintaining pregnancy. This causes the lining of the uterus to thin, making the embryo unable to stay implanted in the uterine wall, while misoprostol triggers muscle contraction in the uterus while also softening and dilating the cervix. The contraction expels the embryo and uterine tissues through the vagina. Here are the potential risks, signs and symptoms, and causes of the mifepristone and misoprostol. The potential risks include incomplete pregnancy and ongoing pregnancy, heavy and prolonged bleeding, infection, fever, digestive system discomfort. Signs and symptoms include heavy bleeding, severe abdominal or back pain, fever lasting more than 24 hours, foul-smelling vaginal discharge. Causes: nausea, vomiting, fever, chills, diarrhea, and headache. Methotrexate and misoprostol. Methotrexate used to end ectopic pregnancy or trophoblastic disease. Tumors develop in early pregnancy, interferes with the DNA synthesis of dividing cells, and so prevents growth. And misoprostol is an effective cervical ripening agent to first trimester surgical abortion. It is recommended especially for women between 12 weeks of gestation, adolescents, and for women in whom cervical dilation is expected to be difficult. Misoprostol can cause birth defects, premature birth, uterine rupture, miscarriage, or incomplete miscarriage, and dangerous uterine bleeding. Side effects of misoprostol include diarrhea, abdominal pain, headache, anemia, nausea, vomiting, rupture of uterus, aches or pains, and constipation. Here are the steps on how to use misoprostol only. First, place 4 pills of misoprostol, 200 micrograms each, under your tongue. Hold them for 30 minutes without drinking or eating. After 30 minutes, you can rinse your mouth with water and drink something. Second, bleeding, similar or heavier than your normal period, should occur after 3 to 4 hours. Third, repeat step 1 with another 4 pills, wait for 3 hours. The last step, repeat step 1 with another 4 pills, wait 3 hours. Conceptus is a fertilized egg, embryo, or fetus. Because the blood type of conceptus is unknown with either medical or surgical termination, all women with Rh negative blood should receive Rh immunoglobulin, ROGAM, or Rh immunoglobulin at the time the mifepristone is prescribed or within 72 hours after the procedure to prevent the buildup of antibodies in the event the conceptus was Rh positive. Medical termination. A medical abortion is an abortion that is completed using a combination of medicines either taken orally or through the vagina. Surgical termination. A surgical abortion involves a minor operation. There are 2 types of surgical termination. These are vacuum aspiration, dilation, and evacuation. Vacuum aspiration can be done with local anesthesia, sedation, or general anesthesia, removes the pregnancy by gentle suction. Dilation and evacuation, the pregnancy is removed using narrow forceps through the neck of the womb or the cervix. Medically induced termination of pregnancy is contraindicated if a woman has a confirmed or suspected ectopic pregnancy. Only methotrexate is used and the woman needs additional follow-up, an IUD in place, a history of allergy to mifepristone, misoprostol, or other prostaglandin, a hemorrhagic disorder, or is taking concurrent anticoagulant therapy. Advantages of medically induced over surgical termination include decreased risk of damage to a uterus through instrument insertion, decreased use of anesthesia necessary for surgically performed. The complication of medically induced termination include nausea and vomiting, diarrhea, severe uterine cramping, incomplete abortion, possibility of prolonged bleeding. After the procedure, a woman may experience SAG, expect mild vaginal spotting, cramping for 2 weeks for post-procedure, caution, use sanitary pads rather than tampons and not to douche to help avoid infection. Avoid taking aspirins for discomfort as this can increase bleeding. Advise to take acetaminophen, Tylenol instead.
Quality improvement. The nurse or nurse practitioner should assess what additional information client will be need to use, choosing form of contraception most effectively. Determine whether clients has any question regarding pelvic examination or other procedure schedules. The intervention is to help complete pre-prescription procedures such as a pap test and pelvic examination. Review method of administration of prescription and steps to take if she forgot to take a pill. The rationale is for the medication administration invariably requires discussion to help clients comply. Nurses can be invaluable in lending psychological and physical support during procedures. So the expected outcome is the procedures necessary for prescription are carried out safely with optimal respect for client privacy and concern. The client states she understands the importance of prescription procedure to ensure her safety.
Lacdo-o 777 is a combination birth control pill containing female hormones, which is the progesterone and estrogen that prevent ovulation. So this medication also causes changes in your cervical mucus and uterine lining, making it harder for sperm to reach the uterus and harder for a fertilized egg to attach to the uterus. So meaning, the Lacdo-o 777 is used as a contraception to prevent pregnancy.
Surgical elective termination procedures involves several different techniques depending on the gestational age at the time of the termination. Menstrual extraction or suction evacuation is performed on an ambulatory basis 5 to 7 weeks after the last menstrual period. After preoperative preparation, the physician inserts a flexible Karman cannula. Narrow polyethylene catheter is introduced through the vagina into the cervix and uterus. The lining of a uterus that would be shed with a normal menstrual flow is suctioned and removed by the vacuum pressure of a syringe. The procedure causes only a minimum of discomfort, perhaps slight uterine cramps. DNC dilation and curettage is used when the gestational age of a pregnancy is still less than 13 weeks. Is a surgical procedure in which the cervix, narrow part of the uterus, is dilated so that the uterine lining can be scraped with a curette. To remove abnormal tissues, DNC has a potential risk of uterine perforation from the instrument used. Prostaglandin or saline induction. A gel or a vaginal insert of a prostaglandin is inserted into the vagina or a tablet is given by mouth. This is typically done overnight in the hospital to make the cervix ripe. For delivery, administered alone, prostaglandin may induce labor or may be used before giving oxytocin. Hysterotomy is an incision made in the uterus. This surgical incision is used several medical procedures including during termination of pregnancy, in the second trimester, and delivering the fetus during cesarean section. Partial birth abortion refers generally to an abortion procedure where the fetus is removed intact from a woman's body. The procedure is described by the medical community as intact dilation and evacuation or dilation and extraction, depending on the presentation of the fetus.